My name is Renata, and I was 34 years old when my aunt looked across the Thanksgiving table and said, out loud, in front of everyone, that I had wasted the best years of my working life. She didn't whisper it. She didn't pull me aside. She set down her fork, looked at me, and said, "Medical coding isn't nursing. It isn't really anything, Renata. You sit in a room and type numbers." I nodded. I picked up my glass. I said, "I know it's hard to picture." And I let it go, the way I had learned to let things go. What my aunt didn't know, what nobody at that table knew, was that I had been quietly building something for 17 years. A credential that took most people 2 or 3 attempts. A record that my department chief could recite from memory. A title that, in certain rooms, made people straighten in their chairs. I wasn't waiting for a moment. I wasn't planning anything. But the moment found me anyway, in a hospital conference room, in front of a table full of staff, on the afternoon my aunt needed me more than she had ever needed anyone. She asked me to explain what I do. I did. Welcome back to channel, where quiet people outlast the ones who never bothered to look. If this is your first time here, hit subscribe. New stories drop every week, and the comments on the last one kept me up reading until midnight. There is a particular kind of dismissal that doesn't announce itself. It doesn't come in the form of a door slamming or a raised voice or an argument that clears the room. It comes in the form of a redirect, a subject change, a smile that lands just slightly wrong. It comes in the form of someone asking your sister about her nursing program for the 4th time at dinner and then turning to you and asking whether you're still doing that computer work. That was my family. That was my life for a long time. My name is Renata Calloway. I grew up in a mid-sized city in Ohio, the kind of place where everyone went to the same grocery store and news traveled fast, and the two professions that earned respect without explanation were medicine and law. Nurses were celebrated. Doctors were revered. Lawyers were tolerated with a certain suspicious pride. And then there was everything else, the work that kept the world running but didn't come with a ceremony or a set of scrubs that people could recognize from across a parking lot. I was the second of 3 children. My older sister, Denise, was a registered nurse. Had been since she was 22. My younger brother, Marcus, had gone into civil engineering and built a career steady enough that nobody ever asked him twice what he did for a living. And then there was me, the one in the middle, the one who had taken a different road, the one who had ended up in a field that most of my family couldn't quite describe at parties. Medical coding. I know what that sounds like to people who don't know what it is. I've seen the expression, the slight pause, the polite nod that means, I'll pretend I understand, and then I'll ask someone else later. For a long time, I tried to explain it. I'd say, every procedure that happens in a hospital, every diagnosis, every treatment, every prescription, all of it has to be translated into a standardized code before the insurance company will pay a single dollar. And someone has to do that translation accurately, completely, and in compliance with a system of rules that changes every single year. One wrong code on a high-volume case can cost a hospital tens of thousands of dollars. One missed code on a complex diagnosis can delay a patient's coverage by weeks. The work is invisible when it's done right and catastrophic when it isn't. Most people nodded and changed the subject. My Aunt Vivian never even nodded. She just moved on. Vivian is my mother's older sister, and for most of my childhood, she was the kind of presence in our family that you organized around without quite realizing you were doing it. She was a retired school principal. Retired, but still carrying the posture and the delivery of someone who ran a building. She sat at the end of whatever table she was seated at. She summarized conversations. She remembered birthdays and used that information strategically. She was not a cruel woman in the way that word usually gets used. She was not unkind for the pleasure of it. She simply had a hierarchy in her head, a fixed ranking of what mattered and what didn't, and she navigated that hierarchy with the same confidence she'd brought to every faculty meeting for 30 years. In her hierarchy, nursing mattered, teaching mattered, law mattered. Things you could explain in one sentence to a stranger mattered. Medical coding did not make the list. The first time she said something, I was 29. It was a birthday dinner for my mother, a Saturday evening, my grandmother's dining room, the good plates out, the kind of gathering that felt important even when the conversation was ordinary. Denise had just been promoted to charge nurse at her hospital. There was a toast. There were congratulations. My mother's face was full. My aunt looked around the table after the toast settled and said, "We have a family of achievers." And then she looked at me, not unkindly, just factually, and said, "And Renata's still finding her path."
I was not still finding my path.
I had been in medical coding for 7 years at that point. I had passed my first certification exam on the first attempt. I had been promoted twice. I was managing a team of 4 junior coders and had recently been asked to lead the audit preparation for a new patient services wing. But I said nothing. My mother changed the subject. My grandmother put more bread on the table. That was how it started. Over the next 4 years, the comments became a pattern. Not frequent enough to call out directly, not absent enough to ignore. They arrived at the edges of gatherings, during the cleanup after dinner, in the driveway while people were saying goodbye, in the background of louder conversations. "Your sister is so busy at the hospital. I don't know how she does it. And Renata, you're still at that billing company?" It wasn't a billing company. It was a regional hospital system. But I understood why it read that way to her. Marcus just got a new project. "And Renata, are you still doing the insurance paperwork?" Not paperwork. Clinical documentation analysis. But I nodded and said yes, something like that. The one that landed hardest came on a Thanksgiving evening in my 34th year. My aunt had had, I think, 1 extra glass of wine. Not enough to make her sloppy, just enough to make her candid. We were sitting at the table after the meal, in that loose, unhurried hour when the food is gone and nobody's quite ready to move. My cousin Brianna had been talking about starting a medical assistant program. My aunt was encouraging her. And then, in the spirit of helpfulness, she turned to me. "Renata, you work in healthcare. What would you tell Brianna about going the certification route versus getting a real degree?" And before I could answer, before I could say a single word, she answered for herself. "Though I suppose certifications are fine for some things. Medical coding isn't nursing, is it? It isn't really anything, Renata. You sit in a room and type numbers. Brianna, I think you want something where people can see what you do." The table went quiet for 2 seconds. My mother looked at her plate. My brother looked at his phone. Denise, to her credit, started to say something. I saw her draw a breath, but I caught her eye and gave a small shake of my head. I said, "I know it's hard to picture." I picked up my glass. I let it go. Vivian moved on to the sweet potato situation. What I did not tell my aunt that evening, what I did not tell anyone at that table, was that I had, 3 months earlier, passed the Certified Professional Coder exam with the highest score in my cohort. That I had, the previous spring, been promoted to Senior Coding Compliance Specialist at Lakeview Regional Medical Center, which was the 2nd largest hospital system in our part of Ohio. That I was, at that moment, overseeing coding operations for a department that processed over 40,000 patient records per year, and that 2 months prior, my team had completed a compliance audit with a 99.2% accuracy rate, a number that my department chief, Dr. Gerald Osei, had mentioned by name in a letter to hospital administration. I had not told them because they had not asked. I had been in this field for 14 years by that Thanksgiving. I had 2 professional certifications, the CPC and, more recently, a specialty credential in risk adjustment coding that fewer than 12% of coders in the state held. My salary was not what my brother made, but it was not what anyone at that table assumed it was either. I owned a condominium. I had a retirement account that I funded deliberately and well. I drove a car that was not new, but was paid off. I was not struggling. I was not waiting.
I was not still finding my path.
I was a professional in the middle of a career, working at a level that most people in my family could not have described if asked, because they had never asked. There was one person in my family who knew exactly what I did. My grandmother, Eloise Calloway, my father's mother, not Vivian's side, had been a hospital administrator for 22 years before she retired. She was 81 by the time this story reaches its center, and she had been slowing down in the way that people slow down when they are not sick exactly, but not entirely well either. She lived in a house she had kept for 40 years, a neat brick 2-story on a quiet street, and she had an opinion about every professional field in medicine that I had ever heard her express out loud. On coding, she was unambiguous. The coders are the ones who keep the whole system honest, she told me once, when I was about 27 and still early enough in my career to sometimes wonder whether I'd chosen right. You want to know what's happening in a hospital, you read the codes. You want to know what's being missed, you read the codes. Administration listens to the coders whether they know it or not, because the coders are the ones telling them what they're actually doing versus what they think they're doing. I kept those words. I kept them the way you keep things that were said to you at exactly the right moment. My grandmother came to my certification celebration dinner. She brought a card with a $20 bill inside, the way she always gave gifts, regardless of the occasion, and she sat at the head of the table and told anyone who would listen that her granddaughter had one of the hardest credentials in health information management and had earned it on the first try. My Aunt Vivian was not at that dinner. She had a scheduling conflict. My grandmother and I talked on the phone most Sunday evenings. She asked about my cases, not the patient details, which I couldn't share, but the professional texture of the work, what kinds of audits we were running, what the new coding guidelines meant for documentation practices, whether the physicians on my floor were getting better at writing notes that matched the complexity of what they were actually treating. She understood all of it. She asked good questions. She remembered the answers from week to week. She was the one I called in March, when Brianna, my Aunt Vivian's daughter, was admitted to the hospital. Brianna was 26. She had been having symptoms for several months that she'd been managing with over-the-counter remedies and a reasonable amount of denial, the way 26-year-olds sometimes do. By the time she went to urgent care on a Wednesday morning, the situation had progressed enough that she was sent directly to the emergency department at Lakeview Regional. Lakeview Regional, where I had worked for 11 years. I found out because my mother called me. She'd heard from Vivian, who was already at the hospital, already in the family waiting area, already using the voice she used when she was frightened, and converted that fear into logistics. Brianna was being admitted. The diagnosis wasn't confirmed yet. There were tests. There was a specialist incoming. Vivian wanted family there, and my mother was going, and did I want to come? I said yes. Of course I said yes. I want to be clear about something, because I think it matters for what came later. I did not go to that hospital with any thought of what might happen next. I did not consider on the drive over what it might mean that I worked there. I did not think about my aunt, or the Thanksgiving table, or the comment about typing numbers. I thought about Brianna, 26 years old, alone in an emergency bay, probably scared, probably trying not to show it. That was the only thing in my head when I walked through those doors. The first 2 days were the waiting kind. Tests came back. A specialist consult was ordered. A treatment plan was developed. Brianna, who had more grace under pressure than I would have given her 26-year-old self credit for, was calm and dry-humored in her hospital bed and complained mostly about the quality of the jello. My aunt was present and tightly wound in the way that frightened people are when they are not allowed to fix anything. My mother came and went. I came and went. I did not announce at any point that I worked at this hospital. It didn't come up. My aunt knew, vaguely, that I worked somewhere in the medical system. Whether she knew it was this specific hospital, I was not sure. It had never seemed relevant to her, and I had learned not to offer information that would be redirected into the nearest available category and filed away. By the third day, Brianna was doing better. The specialist had a plan. The treatment was underway and showing early results. Discharge was being discussed, and a meeting was scheduled for the following afternoon, a patient and family discharge conference with the attending, the specialist, the case manager, and the department chief, Dr. Osei, who participated in discharge conferences for complex cases as a matter of standard protocol in our department. My aunt asked me to come. "You speak medical," she said. It was the nicest thing she had said about my professional life in 4 years, and it landed a little sideways, but I said yes. The conference room on the 4th floor of Lakeview Regional is not a dramatic space. It is a rectangle. A long table. Rolling chairs that are slightly mismatched because at least 2 of them came from a different floor at some point in the past and were never returned. A whiteboard along one wall. A window that faces the parking structure. The kind of room that holds hundreds of meetings a year and remembers none of them. We arrived a few minutes early, my aunt, my mother, and Brianna, who was in a wheelchair per hospital protocol, though she was perfectly capable of walking, and found the wheelchair mildly insulting. I came in behind them. The case manager was already there, setting up papers. A resident I recognized was at the end of the table. My aunt sat down, got out a notepad, and looked at the door. The attending came in first, then the specialist, who gave Brianna a brief update that was reassuring enough that I watched my aunt's shoulders drop about half an inch. Then the case manager ran through the discharge checklist, prescriptions, follow-up appointments, activity restrictions, the paperwork that would go home with Brianna in a folder. And then Dr. Gerald Osei came through the door. Dr. Osei is a tall man. He is the kind of calm that reads in a room before he says anything, the particular stillness of someone who has been in hundreds of tense situations and learned that stillness is the most useful thing he can bring to most of them. He had been the department chief for 9 years. He knew my work the way a conductor knows the musicians who consistently hit every note, not with fanfare, but with a specific and reliable trust. He came in, set his folder on the table, looked around the room, and saw me. And something shifted in his face. Not surprise exactly. Recognition, and then a kind of deliberate decision. He said, "Before we begin, I want to make sure everyone in this room knows who's at this table." The case manager looked up. Brianna looked up. My aunt looked up. Dr. Osei looked at me and said, "Renata Calloway is our senior coding compliance specialist. 17 years in health information management, 2 certifications, CPC, and the RA specialty credential. Her team posted a 99.2% accuracy rate on our last audit cycle, which is the highest this department has recorded in 8 years." He paused. "If you have questions about Brianna's documentation, her coverage, her discharge codes, or anything in this folder, Renata is the most qualified person in this building to answer them. I want you to know that." He opened his folder. The room was quiet. Brianna, from her wheelchair, said softly, "Oh." I did not look at my aunt. I kept my eyes on Dr. Osei. I kept my hands flat on the table. Something in my chest had gone very still, the particular stillness that is not numbness but its opposite, the feeling of a thing landing exactly where it was always going. I said, "Thank you, Dr. Osei." He nodded and said, "All right, let's go through the discharge plan." The meeting was 40 minutes long and entirely professional. Dr. Osei walked through the clinical summary. The attending reviewed the medication list. The case manager confirmed the follow-up schedule. I answered 3 questions, one from Brianna about how a specific procedure would appear on her insurance statement, one from the case manager about a documentation flag that had come through that morning on Brianna's file, and one from the attending about the coding implications of a secondary diagnosis that had been added late in the stay. I answered all 3 clearly, without notes, in the language of my field. My aunt said nothing during the meeting. She wrote things on her notepad. She asked 2 questions about the follow-up appointments. She nodded when the case manager reviewed the prescription instructions. She was composed and attentive and entirely focused on Brianna, which was exactly right and exactly what she should have been. When Dr. Osei stood to leave, he paused at the door and said, "Renata, good work this quarter. The audit results went to administration last week." I said, "I saw. The team worked hard." He left. The case manager gathered her papers. The attending shook Brianna's hand. The resident slipped out quietly. And then it was just the 4 of us, my aunt, my mother, Brianna, and me, in the room with the mismatched chairs. Brianna was the first one to speak. She looked at me from the wheelchair and said, "You've worked here this whole time?" 11 years, I said. She was quiet for a moment. Then she said, "I feel like we should have known that." I said, "It's okay." My mother was looking at her hands on the table. She had an expression I recognized, the one that means she is holding several feelings at once and has decided not to sort through them in public. My aunt was still looking at her notepad. For a long moment, she didn't say anything. The fluorescent lights hummed. Somewhere outside the door, the hallway carried the ordinary sound of a hospital floor, a cart rolling, a door closing, someone on a phone reading off a room number. Then my aunt looked up. Her face had done something I had not seen it do before. Not soften exactly, that isn't quite the word. Recalibrated. Like a measuring instrument that has been brought into contact with a reference standard and discovered it was slightly off. She said, "Renata, can you explain to me, what exactly is it that you do?" I looked at her. Her pen was still in her hand. Her notepad was open. She was asking the way she asked questions when she actually wanted the answer. The way she'd probably asked questions in faculty meetings for 30 years, the way she asked when the answer mattered. I said, "Yes, I can explain that." And I did. I started at the beginning. I told her about ICD-10, the International Classification of Diseases, 10th revision, the code set that the entire U.S. healthcare system uses to document diagnoses. I told her that there are over 70,000 diagnosis codes and over 87,000 procedure codes, and that translating what a physician writes in a chart into those codes accurately is not a data entry task. It is a clinical reasoning task, one that requires understanding both the medical content and the regulatory framework well enough to make judgment calls that hold up under audit. I told her about what happens when coding is done wrong. A upcoded claim can trigger a federal fraud investigation. A downcoded claim can leave a hospital underpaid by thousands of dollars per case, which in a high-volume department accumulates into real financial harm. A missed secondary diagnosis can affect a patient's risk score, which can affect what their insurance will cover next year. The stakes are not administrative. They are financial and medical and legal, and they are why the certification exams have pass rates in the 40s for first-time test takers. I told her about my specialty credential, the risk adjustment certification, the one fewer than 12% of coders in Ohio held. I explained what risk adjustment coding means for Medicare patients, how it affects the resources a health plan allocates to an individual's care, how getting it wrong in either direction costs real people real access. I told her about the audit we'd completed, about what a 99.2% accuracy rate means when you're processing 40,000 records a year, how many records fall in that 0.8%, what it takes to push the error rate that low, what the previous chief had told my predecessor when the department averaged 96%. I told her about my grandmother and about the phone calls on Sunday evenings and about what Eloise Calloway had said to me when I was 27 and still sometimes unsure. My aunt listened. She did not interrupt. She did not redirect. She did not reach for the change of subject that I had come to recognize as her default move when the conversation was requiring her to revise something. She sat in that room with the mismatched chairs and the humming fluorescent lights, and she listened to all of it. When I finished, she was quiet for a moment. Then she said, "I didn't know any of that." I said, "I know." She said, "I should have asked." I didn't answer that one. Not because I was making a point. Because there wasn't an answer that would have served anyone in that room. The moment had already said everything. Brianna went home the next afternoon. She texted me from the car on the way out of the parking structure. "You're kind of a big deal, and I feel like a complete idiot for not knowing." I sent back a laughing emoji and told her to take her medication with food. My mother called me that evening. She said, "I owe you a conversation." I said, "You don't owe me anything." She was quiet for a moment, and then she said, "I let it go too many times." When she said things, I changed the subject because it was easier.
She paused.
"That wasn't fair to you." I said, "I know you were trying to keep the peace." She said, "Peace isn't the same as right." We talked for another hour. It was one of the better conversations we had had in years, the kind that doesn't require anything to be fixed in order to mean something. In the weeks that followed, the cascade was not dramatic. It was quiet, the way most real things are quiet when they settle. My aunt did not make a speech at the next family gathering. She did not send a card. She did not perform a reversal. What she did, and I noticed it because I had learned to notice small things, was stop. She stopped redirecting. She stopped summarizing. She stopped reaching for the comparison that made my work smaller. At my mother's birthday dinner the following spring, someone asked what I did for a living. My aunt, who was sitting 3 seats down and had always before been the first to answer that question on my behalf, with something approximate and diminishing, was quiet. She let me answer. I answered. She listened. After dinner, when we were in the kitchen and my mother was cutting cake, my aunt came to stand near me at the counter. She didn't manufacture an occasion out of it. She just said, quietly, the coding Brianna's team used for her discharge diagnosis. She told me her claim processed in 2 days. She said she's never had a claim processed that fast. I said, the documentation was clean. Clean documentation moves fast. She said, I imagine it does. She took a plate of cake into the other room. That was all. That was enough. There is something I want to say about the way respect works in families. It doesn't always arrive as an apology. Sometimes it arrives as attention, as a face turning toward you that used to turn away, as a question asked in good faith rather than a statement delivered as verdict, as a silence where there used to be a redirect. I spent 4 years in my aunt's hierarchy as someone who had chosen the wrong path, done the lesser thing, missed the significance of what a real career was supposed to look like. I didn't argue. I didn't campaign. I went to work every morning and I did the work and I let the record accumulate the way records do, quietly, verifiably, without needing anyone to witness it in order to be real. The hospital room didn't change my credentials. I had those before I walked in. It changed the room's knowledge of them, and for my aunt, more importantly, it changed the angle at which she was willing to look. I think about my grandmother a lot when I think about this. Eloise Calloway understood, in the specific way that people who have spent decades inside a system understand, that the work nobody sees is often the work that holds everything else up. The coders, the compliance officers, the documentation specialists, the people in the rooms that don't have windows, doing the translation work that makes everything else legible. She saw it because she had run hospitals and knew where the load was actually carried. I wanted to be that person, the one who carried without being seen carrying. Not because I didn't want to be seen, because I trusted that the work would eventually speak in the language of people who could hear it. Dr. Osei was one of those people. He said my name in that room not because I had asked him to, not because I had arranged it, not because I had been waiting for the right moment. He said it because a professional in his field had walked into his discharge conference and he recognized her and said so. That is what it looks like when expertise meets expertise in a room. There is no fanfare. There is just accuracy. I drive home from work most evenings through the same stretch of road, past the same grocery store, past the same set of lights that takes too long, past the lot where there used to be a dry cleaner and is now a smoothie place. I have driven that route for 11 years. I know every pothole. I know which light is fastest in the left lane and which one rewards patience in the right. That evening, after Brianna went home, I drove my usual route. I stopped at the grocery store and bought the things I needed for the week: coffee, bread, the pasta I make when I don't feel like thinking about what to cook. I came home. I put the groceries away. I made tea. I called my grandmother. I told her about the meeting. I told her what Dr. Osei had said. I told her about my aunt's question at the end and the way she had listened and what she'd said about Brianna's claim. My grandmother was quiet for a moment after I finished. Then she said, "Well, he got it right." I said, "He did." She said, "And your aunt, do you think she heard it?" I said, "I think she's going to keep hearing it for a while." My grandmother made the small sound she makes when something lands correctly. Then she said, "Good work this quarter, sweetheart," in the exact same tone Dr. Osei had used, and I laughed, genuinely, fully, for the first time in several days. Here is what I know about quiet work. It compounds. Every clean audit adds to the next one. Every accurate code supports the last. Every year in the field adds a layer of expertise that does not announce itself, but is there, in the precision of your judgment, in the speed of your review, in the things you catch on a second read that you would have missed at year 3. The hierarchy my aunt carried in her head was not malicious. It was limited. It was built from a time and a framework that sorted careers into visible and invisible, celebrated and assumed, and it had never been updated because nobody had ever handed it a reference standard. Dr. Osei handed it one. And the thing about a reference standard is that it doesn't argue. It doesn't need to. It is simply, precisely, exactly what it is, and when the measurement is taken, the gap is just the gap. I have been a medical coder for 17 years. I have 2 certifications. My team posts audit accuracy rates in the top 5% of comparable departments in this state. I own my home. I fund my retirement. I eat well and sleep well and drive the same road home every evening, past the same lights, into the same quiet apartment where the work I do is not visible from the street, but is real in every way that matters. My aunt asked me to explain what I do. I explained it. She listened. That is the whole story. That's my story. A certification earned in silence, a name spoken across a conference table, and a question asked 17 years too late. If someone in your life has ever dismissed the work you built when no one was watching, the career that doesn't come with scrubs or a courtroom or something people can point at from across a room, I want to hear about it. What did you do? Did you stay quiet, or did you eventually say your piece? Drop your answer in the comments. Drop a comment, hit subscribe, and I'll see you in the next one.